by now.
Like most specialists, I've got a lot of patients and not enough hours of the day in which to do all the things that are required. And this is compounded by the fact that I'm servicing a broad range of areas around the state in many remote parts. Today I'm travelling to Port Augusta, which is 300 kilometres north of my base, which is at the Queen Elizabeth Hospital in the capital city of Adelaide.
And this was the site where we had the infection, wasn't it? That's where the spot was. Yeah. That looks pretty good.
Mark Broadbent is one of 20 patients who dialyse at the Port Augusta Hospital. Mark lives 50 kilometres out of town and comes in 3 times a week for treatment at the nurse-operated unit. He has a regular consultation like this every 6 weeks, and until 2 years ago, he would have travelled 5 hours to Adelaide if he required urgent treatment.
Okay, good morning, Mark.
Hey, Dr. Disney.
Today, he can consult with Dr. Disney via the telemedicine link for routine and, when necessary, urgent problems.
Tell me how things are going.
Yeah, well, there was an infection in my arm, so I packed my bags and I come over and seen Dr. Disney on the telemedicine, and he's seen it with another doctor, and he realised it was bad, so I had to go on to Adelaide to have it looked at and treated.
Mark's experience is common. Our telemedicine sites are used successfully by doctors, nurses, patients and allied health workers on average about 30 times a week.
So that's good.
Yeah, it's good. So if you've got a problem, they put you through to the doctor, and Bob's your uncle, you're there. You know, you're kind of in the same room as the doctor, and he can look at your arm. They can get close-up pictures of your arm or whatever's wrong with you, and they can treat you accordingly.
Julie's bringing this up at the Renal conference in Canberra this year.
Most people realise the benefits of telemedicine for teaching and administration, but after 2 years of trials, we are now convinced that it has an important role in clinical diagnosis.
The real challenge was to show that it had some place in the management of patients, that we could assess patients, that we could establish an acceptable human link with them, that we could get a quality of picture that was regarded as adequate for most daily purposes.
There are 8 full-time specialists in our unit, and all of them are now regular users of telemedicine for clinical diagnosis.
Can we have a closer look at Bessie's face? Bessie, can you show us exactly which area of the face is numb?
My lip. These were uncommon symptoms, and we thought we'd like to get one of the doctors from the Queen Elizabeth to have a look. It was something that we were unfamiliar with, and you always take a complaint to the fullest. So we got the telemed out, 5 minutes, had Dr. Roy on the line. He was able to look at the situation, assess Bessie over the telemed, and make the decision that she was to go to Adelaide for further treatment.
So does this patient have pulses, Tony?
I was asked to see an Aborigine patient with a gangrenous toe. And the decision-making process would involve several options. And so it would be nice to speak to a vascular surgeon to see what he felt about it.
And is he diabetic, do you know, Tony?
For telemedicine to be valuable to us clinically, we needed to be able to see skin. The colour, texture and contour had to be clearly visible if we were to make decisions about patients' fistulas and infections.
Whether he had osteomyelitis on his x-ray. So does he have osteomyelitis? It's quite clear the type of ulcer that the patient had, where it was, how deep it was, and in addition to the information that was obtained from Mr. Slobotnik, who was examining the patient at the time, we could make a clear diagnostic and management plan for the patient.
The advantage of the telemedicine was that we could both view the same thing, and that therefore removes the perceptive error that you may get in this per telephone description.
Give me a hand with something in the unit, please.
Hi Gladys, how are you today?
Fine, thank you.
Let's just have a look at this fistula here.
heard you've been having problems.
Yes. Problems with fistulas and needle access are common with dialysis patients. The suburban dialysis centres in Adelaide and the remote centre in Port Augusta are operated by nurses with no resident specialist. They find the probe camera is an essential tool for giving a close-up look at patients' accesses, which are then transmitted via the telemedicine.
There was a hematoma and a stricture formation. Now I can get to see the patient, and if not laying my hand, and I could use the hands of the person that is next to the patient, ask them to examine the patient, and I see what they are doing and get the information from using their hands, not my hands.
The Picture-Tel technology also allows us to capture and store snapshots of the affected area for use at a later date.
So we put the needle somewhere there.
Okay.
We should be able.
It's very important to point out that dialysis is a team game. It requires a team approach from doctors, nurses, educators and pharmacists, for example. This is really where telemedicine comes into its own, where a doctor can make an initial assessment of a patient with physical examination, and the other professionals are then able to have input by telemedicine.
I feel as though I've been going along okay with what I'm taking. I just wondered whether it's going to stir things up again, and perhaps
you feel that everything's been stable and you don't want to rock the boat on the new one, is it?
You think, oh, well, I can get by with a telephone call, there's nothing wrong with a telephone call, but you actually do get so much more from having a face in front of you, because you pick up all the language that isn't spoken.
Tomorrow when you take 100 milligrams, 80 milligrams of that will get into the bloodstream, so it's relatively consistent. Whereas with the old cyclosporin it was much more fickle.
I'll use it for showing patients videos in the remote centres. I'll also use the document camera just to show people tablets predominantly, or I will actually put up a complete list of medications over the document camera as well.
So if you'd like one of those, I can send it up with your next lot of medications.
Yeah. Thanks, Sharon.
I've been using the telemedicine over the last 12 months. Initially, I was perhaps a reluctant user, but I can see advantage in its use now.
John, you've got an appointment to see me soon?
Yeah, next Thursday in Whyalla.
One of the other advantages for telemedicine, particularly with respect to the Aboriginal patients from the remote north, is that it may enable them to go back to their home, or at least the centres close to their home, more quickly.
Little Grant. Hello, Grant. Granddad. Andy. Maggie. Hello, Maggie. That's my sister too.
The patients that come down here from the country are totally isolated. They come down here and they know no one, and they're very lonely. They pine to go home, and in fact some people get sick in the pining to go home, and it's terrible to see. And with telemedicine, we can bring their families into their lounge room virtually. They can talk to them, and their health improves because they get to see their family.
Merry Christmas and a Happy New Year.
Going back to Mr. Max said, Julie, we just like to have another look at that snapshot of his leg.
So I can send that down to you if you like.
All right.
Whether it's clinical diagnosis, administration or psychological support, we are constantly integrating telemedicine into our daily lives.
Yes.
Oh, yeah. Gee, we are, however, particularly positioned, I think, to blend the phenomenon of telemedicine with the computed arrangements which we're undergoing with this system called OASIS. OASIS is a clinical management system which is state-of-the-art and is going to let us share data about individual patients and about groups of patients with other health facilities.
We have quite an extensive electronic database of patient laboratory results, which we can bring up on the same screen of a desktop computer as the impression or the visual image of a patient. So I can be talking to a patient, and with an appropriate click I can then bring up laboratory results, or with another click I can bring up some images which have been digitised from X-ray film, so that I can quickly integrate a wide range of information about a patient and yet at the same time have them in the screen.
The blending of OASIS together with telemedicine gives us a unique opportunity, I think, to manage patients at a distance.
There are a number of telemedicine facilities located in doctors' offices throughout the rural areas of our state. We can access many patients, some of whom might not otherwise take the time to come and see us.
So really the reason for ringing you was to get advice about his worsening renal disease.
Okay, close your eyes again, Gary, and just relax. There we go. You see that, Toby?
Yeah, that's good.
Return is diminished. He's actually got 2 heart sounds. There's no additional sounds that I can
We're really on the base.
We started, as you've seen today, to use the technology to do outpatient on new patients. And the patient that we saw today was a diabetic man who was blind and couldn't use public transport easily to get down from Clare to see us. And we saw him as a new patient, and that's been terrific.
There has been a concern expressed by some doctors that this will lead to de-skilling of country practitioners, and I think there's been some resistance. But really this is no different from sending a patient to the city with a referral letter, and this way I get to learn as well. So I think there's an advantage for the patient's own treatment, and I think there's also the opportunity for us to learn more.
Now with that very bad family history, coupled with the very high blood pressure that we've recorded today, coupled with the fact that you've been smoking 25 or 30 cigarettes a day now for 15 or nearly 20 years, coupled with kidney failure, it's really like putting 4 bullets in the barrel of a gun and spinning it and putting it to your head. You're an absolute sitter for having a stroke or a heart attack.
There have also been several occasions when the telemedicine has been used successfully in acute care situations.
We had a patient, a well-known diabetic patient of ours, who had a hypoglycemic attack at one of the satellite centres, which meant that he became unconscious. And what the nursing staff did was to call me and pop him on the telemedicine, and because I knew him well and because I knew what was likely to happen, we were able to resuscitate him at the satellite centre without having to call him into the main Mother Hospital.
If anybody asks me about cost benefit, I tell them you'll probably find that the cost may increase because your demand is going to increase, but it's the quality of care that one is talking about, and delivering that quality of care all over.
Australian hospitals are well placed to explore the true potential of telemedicine. Everyone knows it's difficult to get doctors to rural and remote areas. It's even more difficult to get specialists.
Port Augusta Hospital is reasonably unique in that there are wards of the hospital up to 800 kilometres away. So, for example, at Oodnadatta, we have a ward of the hospital. We have one at Woomera, which is a hospital in itself, so that we're now starting to talk about places that are more than 1,000 kilometres north of Adelaide. You still have the ability then to tap into, as it were, specialists and experts who can face-to-face interview and deal with patients.
Being part of a leading-edge project like this is very exciting. In public hospitals, there's at times a lot of negative news about budget cuts and so forth. But here's an example of some really positive initiatives which actually are productive and are appreciated by the staff because they can do more in that using this medium, and more importantly, perhaps, or most importantly, the patients.
We've taken telemedicine from a concept to a pilot project to a well-established network.
If I had the choice of either telemedicine or going to Adelaide, I would pick the telemedicine every time. Yes.
We think that telemedicine has an important role in enabling patients to receive quality care at a distance.
It's good to have telemedicine because you don't have to spend so much time in the hospital with outpatient appointments.
It allows for decentralisation of central hospitals and reduces demand for expensive beds in city hospitals. Patients are able to return home sooner or return to a hospital nearer their homes and families.
It's the same as talking across a desk, really. It's no different than meeting the doctor in person.
And finally, it provides the clinical diagnostic backup for hundreds of health workers in isolated medical centres all over the country.
And it's good because in the country, people don't like to go to Adelaide. It takes you away from your family and your friends and the activities. And if you're down there for a long time, it's horrible.